when someone is responding to a stressor, and that state is that the person is not able to regulate his or herself, and with that it goes a long way to play with the person's mental health. And at that state, the person is not able to function normally as before. And now once it starts aggravates, it may now be leading now to issues that do with PTSD, major depressive, PTSD as a post-stress traumatic stress disorder.
Hello everyone, welcome to Africa Health Insight. In today's episode, we are going to explore the intersection of common societal stressors and mental health consequences. So, as usual, feel free to tell us in the comment section what you think we should improve on and areas you think we did well. Also tell us maybe there are some areas that you think we should explore in our subsequent discussions. We're having a specialist in our midst, but for the sake of our family, I would like him to introduce himself. The floor is yours.
Thank you very much, Alice. Etienne is my name, and I am a practicing psychotherapist.
We want to look at the common stressors in society and how they impact the mental health of our communities, of our individuals in our communities. So please, can you tell us how?
Basically, we live in a society full of ills. Definitely break down our psychology. It breaks down the way we function. Some of these stressors are delicate in terms of the fact that some of us go through it and we are not aware. Some of the most common stressors within the context of a society can be talking about issues of conflict. We will be looking at conflicts in terms of the family setting, in terms of the community, even though in terms of marriage as well.
When an individual is having this source of stress, how does it affect the family as a whole?
Cases I have handled in terms of stressors in the society, in the family, and how it affects mental health. Stressors in a family can be coming as a result of misunderstanding between the husband, the wife, and children. So when those misunderstandings arises, it now brings an aspect where the victim is stressed up and gradually developing a mental health psychopathology.
What are some of the physical and mental consequences of some of these stressors to an individual?
Talking about physical and mental consequences of stressors. Physically, we have things like violence, physical violence, and basically looking at mental health-wise, these stressors will definitely result to psychopathologies. Issues start to do with things like acute stress disorder, PTSD, major depressive disorders, adjustment disorders.
Yeah, you made mention of acute stress disorders. Like, can you tell us more about acute stress disorder?
Yeah, we're looking at it based on the fact that when someone is responding to a stressor, the person is not able to regulate his or herself. It goes a long way to play with the person's mental health. And at that stage, the person is not able to function normally as before. Okay. And now once it starts aggravates, it may now be leading now to issues that do with PTSD, major depressive, yes, PTSD as a post-stress traumatic stress disorder. When it also aggravates, it may now lead to what we call the CPTSD, the complex PTSD. Once it aggravates, it has different names. When someone has a major depressive disorder as a result of a stressor, and when it becomes profound and it prolongs up to, let's say, about 2 years and above, it now becomes what we call dysthymia.
We want to know how will a patient, someone manifest, an individual manifest with acute stress disorder.
Yes, talking about acute stress disorder, the person cannot control his or herself emotionally as it ought to be. The person panics and then feels uncomfortable of being around that environment where the stressor is there.
Okay.
And so with that now, the person now starts having what we call adjustment disorder because the person now is not able to adjust with that environment.
Can you tell us more about more disorder?
Yeah, mood disorders disorders that they play along with the way you feel, the way you think, and the way you act. And the most common mood disorders, we have issues like the major depressive disorder and even the bipolar disorder. Those are issues that do with mood disorder. Talking about bipolar here, we're looking at when the person is manifesting what we call hypomania and mania. So those are the aspects when it comes to bipolar, where the person has that's a low mood, which is called the hypomania. The person feels depressed. And now, when someone has mania, you find the person feeling so irritated and having high energy to even do things that the person couldn't have been doing in his or her normal state.
So what are some of those things that someone will feel like doing in an abnormal state, in that mood disorder?
For you to look at what someone is doing in his or her abnormal state of mind and to compare with that which he used to do in his normal state of mind, you are looking at issues that has to do with history, how the person has been thinking, has been feeling, and has been acting. Can we correlate the actions now and the one of yesterday?
Who are those people that are mostly affected in society?
Looking at the number of cases I've treated in terms of stress-related activities are mostly adult. They are mostly the old age group. Most of this aging population will always be complaining of high blood pressure.
What are some of those coping mechanisms you've observed in these individuals and their communities?
Before talking about the coping mechanism, we have to understand that these stressors are there. At times, the victims who are stressed out may not know where to go to. Some of them cope by coming for therapy. Some of them cope by looking at their environment and seeing that they cannot change anything. They have to accept. Some of them cope with it by being irrational, let me say that way, by acting irrationally, maybe by quarreling with children, beating children, or quarreling with wives, beating wives up. That may be their own coping mechanism. Bottom line is that when you find yourself having a stressor around you, I think the best way is to seek psychotherapy.
Can you give us an example of how someone will deal with a stressor?
For you to deal with a stressor, you need to first of all identify the stressor. And when you identify the stressor, you also need to assess the stressor. In the assessment you are looking at, if there is something you can change, then you go for the change. If there is something you cannot change, then you accept what you cannot change.
Vis-a-vis the husbands having stressors and dealing with it by being harassing their wives and their children, have you also had situations where wives, children, they harass their parents and wives harass their children and their husbands as well? And how do you compare that to husband harassing their wives and children?
Looking at these aspects where the wives are also domineering and acting irrationally on the husband, it's a cause for concern because one of the things when this couple come to me, there is a test I must check, which is their personality. When personality clashes, conflict will come on. And so when they now know their personalities, they are able now to subdue, they can understand someone's personality. And they can now also try to see what this person wants me to do which I may not want to do, and the person does it just for peace to reign. So many people are going through, so many, and they don't actually know where to go to. Yes, and they want the marriage to work, but now irrational thoughts will not leave them.
How do you think our health systems can better respond to the health effects of societal stressors?
If you look at our health system is so narrow, just basically within the medical perspective. Our health system should be diverse, both in the medical department and the mental department. Policies can come up. Directors of hospitals can draft something. The psychological aspects of the patients should also be guaranteed. We are moving towards the arena whereby we should not focus just on the medical aspects in terms of our health system, but let us also look at the mental aspects.
Who are the main stakeholders and what are their roles in ensuring the mental health of individuals?
Once you suspect it's a mental health issue, let us not yet call it a psychopathology. You suspect a mental health issue, you just quickly refer to the mental health department. Even some of the nurses who are by the patient, they also observe. When some patients are behaving abnormal to them, they start suspecting that this patient is now manifesting out of the medical condition and now getting into the mental condition. Some of them too work in synergy with me, and we are able to assist them. We have workers too who work in the community, and so the need for publicity, of course. If we're talking about societal ills, and we cannot leave out those who work in the community because they are meeting the people who are facing the ills.
Is there any other thing else you would like to add or emphasize about the impact of societal stressors on health?
There is no society without stressors, and we have to accept that anywhere we are, we should be expecting to have stress. And those stressors, we don't condition them. They come and they meet us, and so we should accept them and attempt possible ways of coping with it. But when it goes beyond bounds, there is a possibility for you to come for therapy. We look at the lasting solution so that we gain self-actualization.
Thank you very much, Etienne. It was a pleasure having you in our platform. You work in a clinical environment, and there are some individuals in communities that want to visit you. Where and how can they meet you? Maybe there are some individuals who also want to expand their educational careers in line with mental health. How can they get to you?
All right, thank you very much. Talking about where you can locate me, presently I am the psychotherapist at the Gwen District Hospital. That's the former PMI, as others would put it. If you come there, I am there, and we can handle issues in terms of mental health. I also teach mental health in a couple of schools. And fortunately, I also happen to be the director of a school, Hamid Training Institute of Science and Technology, where I also train psychotherapists like myself. Yes, at all levels. I run the HND, the degree and the master's program, and so far so good. The mental health department of the school is encouraging.
Once more, thank you for your in-depth discussion on societal stressors. As our family, they know, we will leave Etienne's email on our platform. You can contact him through his email as well as through his contact to have more discussion with him, whether you are suffering from some stressors or you want to know more about mental health education. You can contact Etienne. If you've gone through this video completely, do us a favor and subscribe to our channel so that we can continue to build this family as far as we can. So thank you once more for being with us in today's episode.